In the second half of our discussion on innate defenses, we're going to put all the stuff we learned in the first part about the cells and the chemicals, we're going to put all that together and talk about inflammation. And then just end this lecture on fever, including its benefits and its harm. So an inflammatory response is basically a local response to injury or infection at the tissue level. So it's easiest to think about what's happening with inflammation if you think about what's happening with a cut. And how does your immune system, particularly the innate system, respond to that cut? So the idea, of course, is to limit the spread of the injury as well as to combat an infection. But now inflammation and infection aren't synonymous. You can have inflammation without infection. So things like arthritis, bursitis, pancreatitis, those are all examples of inflammation, but there's no underlying infection behind them. But every time you have an infection, you will have inflammation, because inflammation is the innate defense's way of getting rid of that infection. So again, you can have inflammation without infection, but you cannot have infection without inflammation. Now, to recognize something as an inflammation, just look for this suffix itis on things, like the ones I mentioned: arthritis, bursitis, pancreatitis, hepatitis. Those are all examples of inflammation, okay? Now, effects, what goes on with the inflammation? It's the spread of pathogens slowed down. We mobilize other defenses to overcome the pathogen. We're going to get rid of cell debris and pathogens in the process. And then, of course, repair the tissues that were damaged in the infection or inflammatory process. Now, the cardinal signs of inflammation are shown down here at the bottom. The four main signs is heat, redness, swelling, and pain. Some will add a fifth sign, and that's loss of function. But those five then, basically think of those as our cardinal signs. Now, how those signs show up is based on these things. So capillary dilation, for example, increases the blood flow to the area. That is going to produce the heat and redness. And the permeability means more fluids to the area, so that's going to be the swelling. Okay, and it keep going with those examples. We can see what's going on to cause those signs. And we'll eventually look at all five of these signs and see how things are working. Of course, what causes these things to happen, that's going to be the mediators of inflammation, the white blood cells, the complement, and other chemicals that are going to be triggered to cause inflammation. Now, why do we have those mediators of inflammation? It's because we have some kind of tissue injury. That could be a physical agent, a chemical agent, or even a pathogen that's involved that leads to tissue injury, and therefore we get inflammation response. Inflammation causes these things. We see these symptoms, is the idea. So let's look at some of the chemicals that are involved in inflammation. A couple inflammatory chemicals includes the prostaglandins and leukotrienes. Prostaglandins are there to promote vasodilation. They increase vascular permeability so that we get more fluid and more cells into the area. It's going to induce neutrophil chemotaxis to attract them there to remove the pathogens, and it will induce pain as well. Leukotrienes are involved in chemotaxis, pain, vasoconstriction to limit blood flow and blood loss, and vascular permeability. Now, how do these come about is seen in this slide. So let's say we have some kind of inflammatory cell activity, so we get some kind of inflammation going. There's arachidonic acid in the cell membranes of your tissue cells or in the inflammatory cells. This arachidonic acid will go by either one of two biochemical pathways here. This biochemical pathway leads to the formation of thromboxane and prostaglandin. Now, thromboxane, we saw, like thromboxane A2, is for platelet aggregation and vasoconstriction to reduce blood loss. But this one, prostaglandin, again, as I mentioned over here, that it's vasodilation, increased permeability to lead to inflammation. The other pathway leads to leukotrienes. Leukotrienes as well is going to be involved in inflammation. So prostaglandins and leukotrienes both increase inflammation. So one of the things we want to do in some cases when we have a systemic type of inflammation like arthritis or bursitis or other related types of inflammation, we may want to reduce that inflammation. One of the things we can do to do that is take an NSAID, a non-steroidal anti-inflammatory drug. So things like ibuprofen, naproxen, aspirin are all NSAIDs. What they do is block this pathway. So if I block this pathway, I'm not going to get thromboxane or prostaglandin formed. And we know, remember, we talked about in hemostasis that aspirin reduces coagulation. So here is why. It blocks the production of thromboxane A2, so you don't get help in that way with platelet aggregation and clot formation. But also NSAIDs then are going to block the prostaglandins and therefore reduce inflammation. Okay. Now, another way to go about this is take a corticosteroid. Now, a corticosteroid blocks all the way from the formation of arachidonic acid. So it will block all of these. And so you have reduced inflammation from the prostaglandins and leukotrienes, and also it's going to be anti-coagulation because of its reduction in platelet aggregation. So we see, so it depends on which drug you're looking at and its effects, where it's going to be affected. Now, our diet also influences this. Omega-6 fatty acids, at least some omega-6 fatty acids, tend to increase the amount of arachidonic acid production and therefore can lead to higher amounts of inflammation. Now, omega-6 fatty acids are an essential fatty acid. These are polyunsaturated fatty acids, so they're the ones, they're still good in the sense that they lower your cholesterol levels. But if you need omega-6 fatty acids in your diet, but you don't want to have too many of them because of the pro-inflammatory relationship that these omega-6 fatty acids have. Omega-3 fatty acids tend to reduce the amount of arachidonic acid or have a negative effect on our arachidonic acid, and therefore they're going to reduce the amount of prostaglandins and leukotrienes in production. Again, this is another fatty acid that's essential, so in other words, we have to have it in our diet, but these guys are going to end up being more anti-inflammatory than the omega-6 fatty acids would be. Now, sources of these fats, omega-3 fatty acids, are found in fatty fish, canola oil, flaxseed, walnuts, olive oil, whole grains. Omega-6 fatty acids, which again are still good, they're just a little bit pro-inflammatory, at least some of them are pro-inflammatory. They are found in safflower oil, soybean oil, and some of the vegetable oils. Other inflammatory chemicals include histamine. We saw that earlier, released by mast cells, where they promote vasodilation, increase permeability of the capillaries. Leukocytosis inducing factor, basically to increase the number of white blood cells so that we have more cells going to the inflamed tissue and being able to help with cleaning out the debris and the pathogens that may be there. And then kinins. Kinins are blood plasma protein, either bradykinin or calladin are two examples of these. These are activated by the clotting factors. So if you've got blood clotting going on, kinins are going to be activated along with it. Kinins are very active in the inflammatory response. They're going to cause vasodilation, vascular permeability, and then these are the guys we can blame for the pain that we see with an inflammation or cut. The cells of the inflammatory response include, of course, the neutrophils. These are the guys that are probably first on the scene. They're phagocytotic, so they're going to start eating up any of the debris, damaged dead cells, or the pathogens that are there. But remember, they're limited in how many they can eat. The macrophages also are involved. They're also phagocytotic. They're going to release cytokines to help also induce more inflammation, bring more cells to the area. Mast cells release histamine, again, vasodilation and increased permeability. And then the damaged tissue cells themselves will release kinins, the prostaglandins and leukotrienes, all increasing inflammation to the area. So now if we put it all together, we have this slide, and this is a little complicated, but let's walk through each one of these. So let's start up here. We've got tissue injury. Again, just think of a cut on your finger and what's going to happen. In response to that tissue injury, chemicals are going to be released, such as things as histamine and complement and kinins and prostaglandins, all these things. They're going to cause one of these three things to happen depending on the chemical. So vasodilation of the arterioles means local hyperemia. Hyperemia means increased blood flow. So you've got more blood going to the area. Here's where you see the heat and redness associated with inflammation. If you think about a cut, it's red, it's swollen around the edges of the cut. That came from increased blood flow to the area. Now, the idea of heat is to increase the temperature to allow more metabolic activity of the cells so they can heal. It also helps in reducing bacterial's ability to do things, because bacteria don't like it warm, and so they can't reproduce as well in that warm condition. Increased capillary permeability is going to make the capillaries leaky, so we get exudate formed. That exudate is the fluid that you see building up in the tissues surrounding a cut, and that means we get swelling or edema associated with that increased in leaky capillaries. Also, that swelling, that fluid that's building up, is going to push on the pain nerve endings, putting pressure on those, and that means we get pain as well. So here's two more of the cardinal signs of inflammation. Those two together make the fifth one, because you don't want to move around because you can't, maybe because the area is swollen, or it's such extreme pain you're not going to use that joint or use that part, and that way maybe limit the movement of that to allow those tissues to heal. Another one here, we've got attracting neutrophils, monocytes, and other lymphocytes because of chemotaxis related to the release of chemicals. So that's going to bring in those white blood cells to the injured area. The tissue injury itself will cause leukocytosis factors to be released. That's going to increase the number of white blood cells produced. If we have more white blood cells in the blood and they're going to migrate to that injured area better, remember we have the margination, sticking to the capillary walls, and diabetes, getting them through the capillary walls, and then of course phagocytosis of them. Now again, neutrophils are short term, they can't engulf a whole lot. Macrophages, man, they can eat almost indefinitely. So depending on the degree of infection, though, you can end up with a lot of bacteria, and then of course dead cells and dead neutrophils, those together are going to form the pus. Now the pus then needs to be cleared out, and that's really what the macrophages are doing, and once we get that all cleared out, we're better off and we get more healing. Okay, so all of this together then is basically the inflammatory process. If you can look at this and kind of run down each one of these lines and have it make sense to you, then you've got inflammation down. The last little bit then to this is going to be looking at fever. Now the idea of fever is to maintain a body temperature greater than the 98.6 degrees Fahrenheit by the hypothalamus. Now the idea is the hypothalamus just resets its thermostat. So in other words, instead of 98.6, maybe it's going to be set at 100 or 101. So we have a higher than normal temperature, but it'll fluctuate a little bit up and down around that set point, but it's just a higher set point. What triggers this resetting of the thermostat are pyrogens, and those are going to be released by macrophages and other leukocytes to get the hypothalamus to respond and have a higher set temperature. Now the idea behind this is several. First of all, in a higher temperature, say at like 101 degrees, the liver and spleen will sequester iron and zinc. In other words, they'll hold on to the iron and won't let it out for distribution. Now, if you remember, we talked about this before, that iron is one of those kind of essential nutrients for bacteria. So if I sequester the iron and keep it away from the bacteria can't grow effectively and reproduce because they don't have iron to do that. Another benefit is you increase metabolic rates of the tissue cells so that the cells are better able to repair themselves more quickly. And then we also get more white blood cells produced and get an increased number of white blood cells moving to the area, to an area or systemically, and then mobilizing their defenses. And finally, the benefit is that it interferes with normal bacterial metabolism. They don't like real warm temperatures. And so if you have these really warm temperatures, the bacteria can't reproduce as well. And so you keep them at bay. Now, limits, of course, is how high this thermostat gets reset. A fever between 98.6 and 102, you should just leave alone in general because those are well accepted ability of your body to handle those temperatures. Any fever higher than 102, though, you really need to take fever reducing medications because your hypothalamus has gone a little overboard in setting such a high temperature. Any fever higher than 105, you need to take immediate action because above 105, you can actually have brain damage from the fever. So there are limits to how we can benefit from that. Now, for children, infants under 4 months, you should seek medical help if the fever is higher than 100.4 because they don't have as good a hypothalamus to be able to control those temperatures as well, and it could easily spike. Anybody older, older than 4 months, but still a child, seek medical help when the fever gets higher than 104 and not improving with medication or lasting for 3 days is the typical recommendations by the American Pediatric Association. Now, again, these are just straight guidelines. They're not necessarily written in stone, so, don't hold me to them if you have a kid. Now, also, the idea, too, is when I say 98.6 to 102, you ought to leave alone. In other words, don't take Tylenol. Just tolerate the fever because the fever's doing you more good than it is doing you harm. It just stinks. You don't feel good. But you shouldn't be going to work and school anyway if you have a fever. So stay home, get under some blankets, watch some TV, drink plenty of fluids, and don't take your Tylenol. Let the fever do its job. So that ends our look at the innate immune system. And in the next video lecture, we'll be turning to adaptive defenses.